There have been both internal and external collaborators that have just been tremendous in their involvement in the studies that I work on. One of them is Stephanie Whitwer, who's the nurse administrator of the primary care practice. So I work very closely with her in thinking about the research questions that we want to develop and in implementing the studies. So she's been very helpful in that. We have a physician colleague who's Paul Targonsky, who's been very involved in the practice-based network outside of Mayo. So he's very involved and very committed to community-based care, and he's been just a tremendous support and asset as we've developed especially the community care team intervention. And then externally, my advisor from Case Western, her name is Dr. Elizabeth Madigan. She was my dissertation chair when I was at Case, and she's continued to be an external collaborator, a senior scientist who's available if we have questions about what we're doing in the study. In another study that I'm involved with is a transitional care study, and we've worked with an external collaborator, Dr. Corey Ingram. So he's a palliative care physician in Mankato, and he's been very instrumental in some of that transitional care work that I've also been involved in. We're working now with a study which involves identifying important aspects of patient need that will help us identify what patients really need the care that nurse care coordinators provide. A partner that's been instrumental in that program is Dr. Vicki Hunt, who's a primary care provider here within the employee community health section. So she's one of the co-investigators on that study, and we're all very excited and are interested in what those characteristics are going to be, because we really need to be able to more effectively screen patients and target our interventions towards them. So that's that's a study that's in process now, and we should have results by the end of this year. A second study that Stephanie Whitwer and I have talked about is really looking in depth at those interventions that the nurse care coordinators are actually doing. So we're going to be identifying the problems that the care coordinators identify with patients that they need to work on to self-manage their conditions. Then we'll look at the interventions that the nurses actually work on. So there are things like health teaching, counseling, guidance, collaborating with community providers, and then we'll look at outcomes in terms of how patients experience the care. And then secondly, we'll be looking at how patients have improved in terms of their knowledge of their condition, their behaviors that they're trying to learn to better manage their conditions, and then their overall kind of health status that will be impacted by what they've learned and what they've been working on with the care coordinators. So I think that's another really interesting study that hasn't been reported yet, so we really don't know in depth what the care coordinators are doing and some of these more in-depth outcomes